Assalamu alaikum wa rahmatullahi wa barakatuh. Our topic that will be illustrated now is how to construct MCQ question type A, or it is also called the single best answer question. I will be with you, Dr. Ayman Al-Ashkar, former fellow 2020 and head of medical education training unit at the University of Bisha College of Medicine, Saudi Arabia. Let's start. MCQ type A, or the single best answer, it is commonly used in all exams because it can ensure wide coverage of the content. For example, if the exam contains 60 MCQ questions, so you can ask about 60 items in the course, which for a wide coverage for the content. Be careful, MCQ, it has a function and anatomy. Okay, the function of MCQ is to test the knowledge, understanding, application of the curriculum. But the anatomy will be illustrated now in the form of MCQ question. It consists of three components. Number one, a stem. Number two, lead-in. Number three, a series of choices. What is the stem of the question? The stem is also called the scenario or vignette. It is a clinical case presentation. Then it should be followed by lead-in question. It is a question that should be answered by the students, and series of choices with one correct answer and anywhere from 3 to 5 distractors. Checklist for evaluating MCQ exam item. Regarding the whole item checklist, be careful. This checklist is very important in constructing good MCQ question. Number one, the item reflects a curricular objective. It is very important to revise the curriculum objective before constructing MCQ question. Number two, the item focus on single problem. You can't ask about many problems in the same question, so you will distract your students. Number three, the item is totally independent of all other items for its correct answer. That's to say, question 2 is not depending on question number 10 and so on. So each item is completely independent of the other items. Number 4, the item is free of cultural, gender, or other biases. That's to say, you can't ask about something that is accepted by some cultures and refused by another cultures. You can't ask about something that is accepted by male and refused by female, for example. Then number 5, the item is not unduly demanding the student's total time of the test. The length of the question should be suitable for the time of the exam. Then the item is clear and contains simple language. You should know that the MCQ question, it is not the field to examine the English language of the students. If you ask about physiology, so your questions should focus on physiology with very simple language. Try to avoid jargon, try to avoid inconvenient or strange words. The item is not about asking opinion, because if you ask about opinion, everything will be correct. Whole item is on the same page. You can't make the scenario in one page, then the distractors or the alternative in the next page. It is prohibited. The key is the only correct or clearly the best, to avoid making the question invalid. The key should be the only correct or clearly the best answer. The key item is randomly distributed in all exam questions. For example, the first question, the correct answer A, second question A, third question B, fourth question D, fifth question C, and so on. So the correct answers are randomly distributed in all exams questions. Then checklist for the STEM. Be careful. The student can answer the question without reference to the alternatives. That's to say, if you ask a question and the student cover the alternative, he can ask this question without seeing the alternatives. Then the STEM is clearly worded and free of ambiguity. Try to avoid jargons, try to avoid inconvenient or strange words. The STEM is free of irrelevant or unnecessary details to avoid wasting the time of students. The STEM asks a question that has a definite answer. Then the STEM does not provide grammatical clue to any alternative. For example, you can't ask a question about plural. Then in the alternatives, you put 3 distractors in single manner, then 1 distractor in plural. So this is a clue for the correct answer. And also negatively worded STEM should be avoided. Checklist for alternatives. First of all, alternatives are all homogeneous to the questions asked. If you ask about, for example, a helminths, the alternatives should be for helminths. If you ask about a bacteria, the 4 alternatives should contain bacteria, and so on. All distractors are plausible. Of course, you can't ask about helminths causing gastroenteritis or GIT troubles, then put in the alternatives a car accident. Of course, it is non-plausible. Alternatives are grammatically consistent with the STEM. That's to say, if you ask about single item, all the alternatives will be single. If you ask about plural, all the items will be plural, and so on. Alternatives are in one column, which is important. If you put 4 alternatives or 5 alternatives, they should be in one column. Then alternatives have not overlapped distractors. For example, if you ask about age group or reference range, for example, you can say from 10 to 30. Then the second one from 15 to 30. And third one from 25 to 35. So there is overlapping of distractors. Alternatives are stated as briefly and simply as possible. No common words repeated in all the alternatives. If there is a common word in the alternatives, you can mention it at first, then put the alternatives following it. For example, if you ask about Plasmodium, we have 4 famous species affecting man, for example. So if you write Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium falciparum, you can simply write Plasmodium, then semicolon, A, vivax, B, ovale, C, malariae, D. Falciparum. The alternatives are free of trickery words. Again, we emphasize on using simple word. This is a medical exam, not an English exam. The rationale behind the exam is to check knowledge and understanding, not to make tricks with the students. Continuation for checklist for alternatives. All of the above and none of the above are not used. Keywords from the stem are not repeated in the alternatives. For example, if you have keyword in the question, you can't put it in the alternatives because it can lead the students to the correct answer. The key is not stated in greater length. Some teachers and some doctors may make the correct answer is the most longer or the longer one, which is wrong. You should make homogeneous alternatives, even in the length. The absolute terms like always, never are not used because they will be excluded by the students. Then the key is not stated in the textbook language. You should paraphrase the correct answer, not put it like what the students see in the textbook. The same number of alternatives are used in all questions in the exam. You can't use in one question 4 alternatives. Then in the next question, 5 alternatives. And so on. This is an example of good MCQ question. For example, the stem. A 32-year-old man has a 4-day history of progressive weakness in his extremities. He has been healthy except for an upper respiratory tract infection 10 days ago. His temperature is 37.8 degrees centigrade. Pulse is 94 beats per minute. Respirations are 42 per minute, 42 cycles per minute and shallow. And blood pressure is 130 over 80 millimeter mercury. He has symmetric weakness of both sides of face and the proximal and distal muscles of extremities. Sensation is intact. No deep tendon reflexes can be elicited. Papinski sign is present. Lead in question, which of the following is the most likely diagnosis? Check the alternatives. Acute disseminated encephalomyelitis, Guillain-Barré syndrome, myasthenia gravis, poliomyelitis, and so on, and polymyositis. Note that incorrect options are not fully wrong. The options can be diagrammed as follows. D, C, A, least likely diagnosis, but B is the most likely diagnosis. It is Guillain-Barré syndrome. Another example of MCQ type A. Fahd is 40-year-old, went to hospital to do the pre-operative investigations. His blood pressure was 160 over 100 millimeter mercury. Weight was 70 kilograms. Height was 171 centimeters. Normal renal and hepatic functions with random blood sugar 120 milligram per deciliter. No abnormality detected in chest X-ray, abdominopelvic ultrasound, and the coagulation profile. This is the scenario. The question: what is the main cause of elevated blood pressure in this patient? The choices are alcohol consumption, obesity, idiopathic or pheochromocytoma. Here we have a scenario, then let in, then choices or alternatives. So all the alternatives can cause elevated blood pressure, so they are plausible. Examples of badly constructed MCQs. Which type of plasmodium cause malignant malaria? Plasmodium, then semicolon, vivax, oval, malaria, falciparum. What's wrong with this MCQ question? It has bad anatomy with no stem. Another example, a 36-year-old manual worker returned from Nigeria 10 days ago, suffering attacks of fever, shivering, excessive sweating that may be repeated every 48 hours and sometimes were sustained. He reported history of frequent mosquito bites during his stay there. Which of the following is the most likely diagnosis? Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, all of the above. The correct answer here is Plasmodium falciparum, but we have an obstacle here, or pitfall, which is all of the above. A 36-year-old manual worker returned from Nigeria, the same scenario in the previous slide, but with me, look to the alternatives or the choices. The choices here, what is the wrong arrangement of these choices or alternatives? They are presented in two columns. This is the first column, this is the second column, which is wrong. A 36-year-old male was about to be drowned. كان على وشك الغرق. He was rescued by some sailors who performed cardiopulmonary resuscitation for him with direct lip-to-lip sealing. What is your opinion regarding sailors' action? Strongly agree, agree, neutral, strongly disagree. What is wrong? What is the defect in the construction of this MCQ question? The defect is, what's your opinion? We can't ask about the opinion. Then a 36-year-old male have nausea, vomiting, abdominal pain, diarrhea. He gave history of eating improperly cooked fish. What is the most likely diagnosis? Now, see with me the distractors: hypertension, tinea saginata, fascioliosis, heterophiasis. What's wrong with this question? What is the defect in this question? The defect, the first alternative, hypertension, is not plausible, is not possible. Patient have GIT troubles, nausea, vomiting, abdominal pain, diarrhea. So the alternatives, we have three homogeneous alternatives: tinea saginata, fasciola, heterophis, and a strange alternative, which is hypertension. Then a 36-year-old male have nausea, vomiting, abdominal pain, and diarrhea. He gave history of eating improperly cooked fish. What is the most likely diagnosis? It is heterophiasis. Let's see the second question. The same scenario, but the patient gave history of working in slaughterhouse and eating raw beef. What is the most likely diagnosis? Here, the distractors, not all the distractors in the same page. Okay, so this is the defect in this question. Not all the question in the same page. Let's see the next slide. C and D alternatives, which is wrong. Then let's see this question. 13-year-old child have nausea, vomiting, abdominal pain, diarrhea. Which of the following could not be the correct diagnosis? Xanthina solium, saginata, Hemiolipus nana, schistosoma, hematopia. Negatively worded questions are not accepted. Then look at a scenario for a patient. Then here, look at the distractors. What is the defect in the distractors? The defect here is overlapping. Here is the first choice from 18 to 25. Then B, 18 to 35. C, from 25 to 30. D, from 30 to 35. There is overlapping of the distractors. Then look at these two scenarios and questions. What is wrong with this formulation of MCQs? Look at the alternatives here. We have 4 alternatives or distractors, but here we have 5 distractors. In any exam, you should make it unique for all the exam. The number of distractors should be fixed. You can use 4 distractors for all questions. You can use 5 distractors for all questions. At the end, I hope this lecture is helpful for all of you. And lastly, thank you all and hope you all the best.